for your first scenario where it's a brand new vaccine, what you're saying is placebos are already part of the process of bringing something like that to market. For the second scenario, for an update, it sounds, my question to you is there scientific or medical evidence or reason for RFK Jr. to have proposed this? Or do you think it's a delay tactic from a noted vaccine skeptic?
Yeah, it's hard to, it's hard to say what his motivation is, but I would just question the scientific rationale for what he's proposing to do. And it really depends on how significant a change it is from the updated vaccine to the previous one. In some cases, it would make sense to do a randomized placebo-controlled trial. Let me give you an example. So the first polio virus vaccine that was made available to Americans was the Salk inactivated polio vaccine. Eventually, was switched over to an oral live attenuated polio vaccine from the laboratory of Dr. Albert Sabin in Cincinnati Children's Hospital. Sure, that's a significant enough difference to warrant doing a new set of randomized placebo-controlled trials, but that's very different from slight variation in the genetic makeup of an mRNA vaccine, say from the BA1 Omicron variant to, say, an XEC Omicron variant. To me, I don't necessarily see the rationale of doing a brand new placebo controlled trial. I think a bridging study is adequate, and I don't know that it's even feasible to ask to even do a brand new randomized placebo controlled trial. So the at multiple levels, his statements or recommendation don't seem to be well grounded in science to me.
If he does proceed with a full randomized placebo study of the flu shot and the COVID booster, what would that mean for consumer access to these vaccines? I'm used to seeing advertisements in local pharmacies starting in September, typically. Would they be available on their regular time frame?
Yeah, that's a good question. I think it might be really problematic. Remember, it's a pretty carefully orchestrated dance getting that new flu vaccine out in September. The vaccine producers need 6 months to confirm that they can even grow the virus in whatever medium they're using, whether it's chicken eggs or whether it's on cell lines. They have to get an adequate amount of virus, what we call titer of virus, and then the vaccines still have to go through safety studies. It's pretty impressive that they can do all that as it is, given the short timeline that they've got. Basically making the decisions in oftentimes in the early part of that year and getting it out as a safe and effective vaccine by the late summer, early fall. And they do that carefully orchestrated dance every year. Now, if you require extensive additional studies, effectively speaking, I would imagine that would mean that they couldn't have that vaccine available in time. And the same with the mRNA. I mean, mRNA technology is useful because it's pretty quick, but it's not that quick. You still need time, and we still need to do the safety testing and everything else. So again, I don't understand, and I guess it's fair enough to ask for clarification, because maybe that's not what he means. The way the statement was put out seemed to be somewhat ambiguous as well.
The ambiguity can lead to anxiety, especially among those who are immunocompromised and/or elderly and/or otherwise in a position of wanting and needing that booster as soon as it's available. If someone within that patient population is watching this and is concerned, do you have a message for them? Is there anything they can do at this point in time to protect themselves or to get access to a vaccine that they feel and their doctors feel that they need?
Well, hopefully the vaccine producers will come to get some clarification from the FDA. That would probably be the first step. So hopefully, cooler heads will prevail, and some sound decisions will be made. So I wouldn't panic just yet. And the hope is that updated vaccines will be made available in the United States.
If they are not available in the US, and this is perhaps a speculation question, but could we start seeing medical tourism where Americans go to Europe to get the boosters that they need if we can't have access here?
So what does that White House press secretary always say? I'm not going to engage in hypotheticals.
Fair enough.
That seems to be the line of the year for 2025. And yeah, I mean that could be an option, to go to Canada or to go to Europe, but hopefully it won't come to that.
Hopefully it won't come to. Now, you